Hi, welcome back. This is, as usual, Sonda Kasonde from Living Hope Clinic, your friend and partner in health issues. Today, like I mentioned last time, that there's an alternative that we can help people not to be on long-term treatment. And I'll just discuss one of the conditions so that you understand exactly what I'm talking about. Today, we will discuss cervical cancer. I don't want to take it for granted that you know where cervical cancer is. I'll simply describe where. A cervix is just a small cylindrical canal that comprises of the neck and the lower part of the uterus. That's the part of the organ in a female that we are talking about. It has this central canal, which is for the birth of the child from a pregnant woman, and also for your menstrual blood, and also for passage of sperm as well. This important organ is lined with two types of cells. The two types of cells, one of them is for protection, and the other one is for secretion of some mucus, which is used as a lubricant. And for protection is for protection from external injuries. So these special cells are the ones that start growing abnormally as a cancer. Now, you need to understand that a cancer just doesn't come like lightning from the sky. It has different stages. And if anything, cervical cancer is a cancer that has got very well-defined stages, such that if it is identified quickly, even the treatment is very successful. Very successful. The only problem we have is that at times we go to the clinic when we are in the late stages and we can't reverse it. That's why we've been emphasizing of each and every woman to be checking for cervical cancer because of those stages that it goes through. And when we are able to identify it at an early stage, maybe just in the primary stage, it's easy to manage and you may not eventually suffer from cervical cancer. So cervical cancer just starts as abnormalities. In fact, any cancer starts just as abnormalities or abnormal growth of cells in that organ, be it in the breast, in the prostate, in the brain, in the stomach, wherever you have that cancer, it starts like that. So if it is caught in early stages, then we can simply manage it. I'll go straight to looking at what is it that causes this cervical cancer. One of the causes, or which causes about 99.8% of the causes of this cancer, it is a virus that we call human papilloma virus, which is gotten from men. So it simply means this cervical cancer is a sexually transmitted disease. And the other cause of cancer, of this cervical cancer, is the early sexual debut, multiple sexual partners, those in the low income class because of their poor nutritional status, and those women who take contraceptives for a long time for their family planning. And also one of the highest risk factors is smoking. Okay. Then the other cause that has not been mentioned in most of our books, it's the heavy metals, heavy metal deposits. Heavy metal deposits, they have a problem with the cells because they attack the shape and the function of the cell. If the shape and the size of the cell is altered, it means even its function is altered. It may not function the way it's supposed to function. Like the way I mentioned that the squamous cells on the cervix are for protection. So and these cells are also thin, very thin and flat. So if you find that they start thickening, and then they start thickening and changing their shape, then it means even their function of protection will not be as it is supposed to do. So these heavy metal deposits also cause those changes in those cells. Heavy metals have a high affinity for organs that are mostly composed of fat. So like the brain, the kidneys, the intestines, as well as the cervix, there is no bone there. So you find that they cause those alterations in the cells. I also mentioned that also nutritional status plays an important role in the prevention and cure of such cancers. So diet is one of the most important things when it comes to treatment. It has been discovered that people who have cervical cancer, most of the time they are lacking certain vitamins and minerals. So if you came, we do a full body scan, we'll be able to identify the minerals and the vitamins and other essential elements that you need for the body to function properly. We'll be able to isolate them, and in your prescription, when we do what we call a pap smear, we find that there are those abnormal changes on the surface of the cervix. We'll be able to see that probably you're just lacking vitamin A, you're lacking vitamin C, you are lacking maybe zinc, you are lacking just those small elements that we need to put back. And we'll start checking. At least maybe every 3 months we check again to see if the changes are improving or not. If they are not improving, then again we will suggest, or whoever is attending to you, they will be able to suggest what needs to be done at that moment. So those are the conditions that I'm saying. You may not even go into chemotherapy. You may not even need to go into long-term treatments. You may not really need to be admitted and be kept in the hospital because now you have cervical cancer. But if we can act quickly, we'll find that some of these problems may be abated before you go into complications. So why not go and visit your nearest health center and ask the nurses there or the doctors there just to do a pap smear on you. It's not a complicated procedure. They'll do it quickly and they'll be able to give you results. See you next time for another interesting episode. Thank you.